Hey guys, Dr. Andy here. Today I want to talk to you about Achilles pain in long distance runners. It's not just an exclusive long distance runner injury. I keep seeing it a lot with my teachers and my nurses, right? But we are approaching marathon season when everyone's going out and increasing the amount of miles that they're doing outside, hitting the pavement. So I did want to address it now before things kind of start to get out of hand, right? So as we increase miles, or let's say you're a nurse, you're a teacher, and you're getting back to school and suddenly you're like, oh my God, I'm on my feet so much more, right? You'll start to notice that certain things, fall off the rails. And one of the most common injuries that we start to see is Achilles type pain, right? So Achilles pain is going to be right down here, right above your heel, of course, is the Achilles tendon. It is a very common tendon injury whenever we have muscle imbalances and issues going down in the lower leg, right? So you're designed to sit, you're designed to stand for long periods of time. What happens is if you do it too much, you can cause an injury, or if you have an imbalance, let's say your ankle joint is locked up, your low back joint is locked up, it increases the strain in these muscles down here, especially your calf, and it can cause all of that tension to go down into your Achilles, and you can cause some ripping and some tearing that can't heal overnight. That's what we call a repetitive stress injury, okay? So I want to show you today how we do Graston therapy for that area. So Graston, what it's going to do is it's going to activate a ton of these little nerve fibers that help kill pain. We're trying to increase blood flow, clear everything out so that we can speed up the healing process in the Achilles, okay? I'm going to show you the Achilles, but typically if we're doing it, we're also going to hit the calf as well. We're going to work all the way on down, but at the moment, we're just going to show you the Achilles, okay? First thing that you do is you put a little emollient down on the skin. Emollient is just beeswax, all right? It helps the metal Graston tools, the stainless steel Graston tools, the instruments, to glide smoothly over the skin so that you don't feel any pain, okay? So this is more common. Usually when we're up in the back or the low back, we're using a bigger Graston tool, right? These ones actually, once we get started into these like lower, smaller body parts, we can start to use the smaller tools with a little bit of edges to them or little indentations. And what we're going to do first is we're going to scan the tissue. So using the inside part, we just run it along the tendon, and very quickly we can notice and we can feel if there's any kind of what we call like adhesions in the tendon or underneath in that skin, okay? And what it feels like is it's nice and smooth, and then suddenly it feels like there's sandpaper underneath the skin, and I can actually feel like it's like grinding over some sandpaper, okay? And that's where we actually can use this as a scanning tool, almost like diagnostics, to know like, oh, this is an area that really, really needs it, okay? So we use more of a pointed end. We get in, we do a little star formation. We find that area where it needs it, where it's like sandpaper, and then we do a star where we go in all directions. Each spot takes about 30 seconds to a minute. And every, 10 seconds or so, we change directions. It's very common when we do this. We start to develop something called petechiae, where under the skin we're bursting little blood vessels and it actually just looks bright red. I'm not doing very hard in Miss Regina today, but it becomes really bright red. You start to notice all these little tiny red dots. And then after that, the secret sauce is to do either side of it as well. Don't do right on top, but do right on top, of course, but then also do kind of like underneath it to one side, and then get the other side as well, okay? So treatment for Graston usually lasts, 5-10 minutes. We're gonna get the Achilles itself, we're gonna get the calf. If you got like plantar fasciitis, there's some issues in the bottom of the foot, we can clear that out as well. So if you're a teacher, a nurse, absolutely like a long distance runner, and you are on your feet a whole lot, you're putting those extra miles in as a big race is coming up, and you wanna make sure that this problem doesn't develop so it doesn't impact your runners. I can't tell you, I've had a couple of patients, who are marathon runners, and 2 weeks before their marathon, they have to pull out, because we weren't able to they weren't able to clear out some of this stuff on their own, right? And then we came in a little too late. So if you got any of these problems, try some stretching at home. You're going to want to try stretching that calf as much as you can. But if that doesn't work its way on out, and you do good rest, and you have a good enough rest, and you're hydrating enough, and you still have some problems, give us a call. We'll do our best to help you out. If you have any questions, send them our way, and always remember to live with passion, not pain.